90 days is all it takes to get rid of stubborn fat. Women, do I have your attention yet? And men, if you're interested, yes, that's all it takes, and no surgery. And here to talk to us about the procedure that we need is Dr. Ewart from Augusta Plastic Surgery. Thank you for joining me.
Thanks for having me.
So this is so interesting, a cool new procedure, literally cool. It's CoolSculpting. Tell me all about it.
Exactly. So CoolSculpting is this amazing new technology that removes unwanted fat without surgery. So it's based on this study, and that was in the pediatric journals, where they have children who would eat a popsicle every day, and they would keep it on one side of their cheek, and parents would notice that side would have less fat. So they would look a little asymmetric, and so these Harvard scientists ran with this idea, and they developed this technology where we can put these applicators on different parts of the body, and you can reduce fat that way.
Freeze the fat, and it literally diminishes that in that area. I think that is so incredible, and how cool it just came from somebody eating a popsicle and seeing the difference in their cheek. Now, we actually have a video so that people can get a visual of what it does to the inside of our body. Is that right?
Right. So we have this video, and we'll show it here. So what it does is the fat cells are more susceptible to cold than the skin is. So these applicators will draw the skin and the fat up inside.
CoolSculpting targets
and the fat cells will die. And about 25% of the fat cells will die from this procedure. So wherever the applicator is placed, you'll see the results in that location. Now, it doesn't work instantly. This process that you're seeing here takes, yeah, exactly. So after about a month, you'll see a little bit of a change, but over about 90 days, you'll see kind of all those cells gone. Exactly.
And so how many times do you need to get this done? Is it just a one-time thing? You see the best results in 90 days, or can you go back and do it again?
So most patients just need one treatment. Now, and that takes, like I said, about 25% of the fat from that area. But let's say that you see a little bit of improvement and want to see a little bit more. Well, you can have it done again and see another 25%. But most patients usually only need about one treatment per area.
Wow. And so tell me, is it just in the stomach, or can I get it anywhere else?
Well, that's the great thing. You can actually apply it anywhere that we can pinch an area, we can treat. So the most common areas are usually the love handles or the lower abdomen. Some people get the outer thighs or the inner thighs. So
the saddlebags.
So the saddlebags.
The love handles.
Exactly.
The belly flop, or what would you call it? So you can get all those areas done.
Yeah, all those areas can get done.
Ooh, and one of the bigger ones is the swimsuit, the inner thigh gap.
Yeah, so the thigh gap, and that's something that's kind of a newer term, I guess, but that's something that people have really caught on to and ask us about a lot.
Okay, and we have some before and after pictures that you're showing of specific areas. What are the pictures that we're looking at right now?
Yeah, so we got a couple photos here. One is looking at the love handles, and we can kind of see how that area can really get improved from this procedure. That's probably the most common area that we get requested when people come in. But also the lower abdomen. If you look here, we can see some of the lower abdomen seeing improvements after 90 days. And some patients, again, one treatment can really make an improvement. Sometimes we do need a second treatment. And then the inner thighs. The inner thighs, you can really see an improvement from this area as well.
Well, there you go. You see from before and after, it actually does work. Such a cool procedure. You like what I did there? CoolSculpting. Well, thanks so much for joining us and talking to us all about it. I mean, 90 days is all it takes, people. You can get rid of your stubborn fat. Just say bye-bye to it all. Thank you so much, Dr. Ewart, for joining us. He is from Augusta Plastic Surgery. If you have any questions, feel free to visit the dish on 6.com, and maybe you can get rid of stubborn fat.